Dear students, this is Terez Boshra Kamel, an Associate Professor of Pediatrics at Shams University. I will speak today to you about tuberculosis. My lecture will be 3 parts. We'll talk about the etiology, diagnosis, prevention and management of tuberculosis. By the end of this lecture, you should be able to identify what causes tuberculosis as a disease, what are the ways of transmission of infection, to explain the difference between latent TB infection and TB as a disease, to diagnose tuberculosis and its complication in a given clinical description, and the purpose management outlines, to classify tuberculosis according to clinical presentation and decide the need for chemoprophylaxis and treatment accordingly. You will be able to apply acquired knowledge on virtual case scenarios and the clinical situations in face-to-face session. What about the epidemiology of tuberculosis? 95% of tuberculosis occurred in developing countries, as we see from the map. WHO estimates that more than 8 million new cases of tuberculosis occur around the world, and 3 million people die yearly out of tuberculosis. Of them, 1.3 million cases and 450,000 deaths occur among children per year. So we must study about tuberculosis. Why do global burden of tuberculosis continues to grow? That's because HIV epidemics, population migration patterns, increasing poverty, crowded living conditions, inadequate health coverage, poor access to health services, because inefficient tuberculosis treatment, and because inefficient tuberculosis control programs. Tubercle bacilli are special types of bacilli. They are non-spore forming, non-motile, pleomorphic. They are curved rods, small, 2 to 4 micrometer long. They are obligate aerobes. What special case of tuberculosis bacilli, special bacilli? The hallmark of all mycobacteria is acid fastness, the capacity to form stable mycolate complexes with stains. So once stains, they resist decoloration with ethanol. They need a special type of stain. You remember from your microbiology? Yes, they are Zell-Nelson staining. Why is it resistant? That's because a lipid-rich cell wall, which also accounts for the resistance to the bactericidal action of antibody and complement among our body. How transmission of Mycobacterium tuberculosis occurs? Person to person, usually by airborne mucus droplet nuclei, having particles 1 to 5 micrometer in diameters, through coughing, sneezing, speaking, singing. So transmission occurs when another person inhales these droplet nuclei. The chance of transmission increases when the patient has an acid-fast smear positive sputum, an extensive upper lobe infiltrate or cavity. The person has copious production of sanus sputum, severe and forceful cough. Environmental factors that encourage infection, especially poor air circulation. Remember that we need about 10 to the power 5 organisms for positive smear. Adults produce 10 to the power 8 mycobacteria per sputum, while children 10 to the power 4. So only adults can transmit tuberculosis. Children have paucibacillar tuberculosis, so they are not infectious. You know a special type of tuberculosis, it's called Bovine TB. It is caused by Mycobacterium bovis. It occurs when Mycobacterium bovis may penetrate the GIT mucosa or invade the lymphatic tissue in the oropharynx, with a large amount of the organism ingested through infected milk. Bovine tuberculosis can potentially infect the human, resulting in lesions across the respiratory tract and body. Human can contract bovine tuberculosis from cattle primarily through drinking milk contaminated with these mycobacteria. However, the overall risk of human is low since milk is now routinely pasteurized. Child with facial lesion from bovine tuberculosis can occur when infected from touching and drinking contaminated milk. Other animals also can potentially spread bovine tuberculosis to human during close contact, as we see from this figure. So now revise and test your knowledge about TB transmission. What organism causes most TB disease? Mycobacterium tuberculosis. What are 4 other mycobacteria that cause tuberculosis disease? Mycobacterium bovis, Mycobacterium africanum, Mycobacterium microti, and Mycobacterium canati. And remember, there is another type of mycobacteria that cannot cause tuberculosis. It is called Mycobacterium avium. It causes granuloma-like condition, but not a TB disease. It is called Mycobacterium avium complex. How is TB spread? TB is spread from person to person through air via droplet nuclei containing Mycobacterium tuberculosis. The probability that TB will be transmitted depends on what 4 factors. Remember, infectiousness of the person with TB due to the previous causes we mentioned, the environment in which the exposure occurred, the length of exposure, and the variance of these tubercle bacilli against the human immunity. Tuberculosis pathogenesis. Pathogenesis is defined as how an infection or disease developed in the body. From this figure, when the person is infected, he has got the initial infection. Macrophages in our body, this is the innate immune phase, will ingest these mycobacteria, aiming to contain the disease. And cell-mediated immunity will start with neutrophils, innate lymphocytes, and necrotic cell will be contained inside. And CD4 T helper cells will come, CD4 and CD8 will come outside lymphocytes to help to contain the disease. If the predominant CD4 helper cells have the action, will help in, the macrophage to kill intercellular organisms, and calcified and eradication of the granuloma occurs. However, if the CD8 suppressor cells causes lysis of the macrophages, of the infected macrophages, resulting in the formation of caseating granulomas, helping that the cytokines and tumor necrosis factor, helping in damaging the tissue and caseation of the infection. However, remember that antibodies have little role in TB infection. So, what is the outcome when a person is infected? Exposure to an infectious case, we have the initial infection. So if I am infected, I have some hypersensitivity reaction against mycobacteria, so I have tuberculin positive test. What will happen to me? More than a 5% chance I will have primary disease. 95% I will have latent TB infection, which means I have positive tuberculin test, but I am normal without no symptoms and without no disease in 90% of cases. However, 5% of cases will have reactivation of TB, either extrapulmonary or pulmonary, according to the site of mycobacteria. Ratios more than these occur if I am immunocompromised or in patients with HIV AIDS children under 5 years of age. Latent TB infection. Latent occur when tubercle bacilli are in the body, but the immune system is keeping them under control. Latent TB infection detected by Mantoux tuberculin test or by blood tests such as interferon gamma release assay is called IGRS. People with latent TB infection are not infectious to others. While TB disease develops when immune system cannot keep the tubercle bacilli under control. TB disease may develop very soon after infection or many years after infection, depending about the immunity of the person infected. About 10% of all people with normal immune system who have latent TB infection will develop TB disease at some point in their lives. However, untreated infants, because they have lower immunity with latent TB infection, have higher figure, have up to 40% likelihood of developing tuberculosis. People with TB disease are often infectious to others. So remember this comparison, please. Latent TB versus TB disease. Latent TB infection, when inactive, active, contain tubercle bacilli in the body. They only have positive tuberculin test or positive IGRS test. Chest X-ray usually normal, sputum smears and cultures negative. They have no symptoms, they are not infectious to others, they are not a case of tuberculosis disease. TB disease, I will talk if it is a pediatric pulmonary tuberculosis. They have active multiplying tubercle bacilli in the body, in their lungs. They have TB tuberculin test positive and IGRS test usually positive. Chest X-ray usually abnormal. They have sputum smear and cultures may be positive. Some symptoms like cough, fever, and weight loss, often infectious before treatment. They are a case of tuberculosis. How progression of tuberculosis disease? Risk of developing tuberculosis disease is highest in the first 2 years after infection. People with latent TB infection must be given the treatment because they have the risk 10 to 40 according to age to have TB disease. So they must have the treatment to prevent them from developing tuberculosis disease. Detecting TB infection early and providing treatment helps in preventing new cases of tuberculosis disease. What are the sites of TB disease? Bacilli may reach any part of the body, but there are some common sites which include the lungs, pulmonary TB, the CNS, the GIT, bones and kidneys. These are the common sites. But the common extrapulmonary site is TB lymphadenitis, lymph node having tuberculosis. So the signs and symptoms of tuberculosis in children can be asymptomatic latent TB infection, pulmonary tuberculosis, or extrapulmonary tuberculosis. So revise with me. What part of the body is the most common site for tuberculosis disease? Lungs are the most common site of tuberculosis disease. What are some other sites? Larynx, lymph nodes, pleura, brain, kidneys, bones, and joints. What is the most common site for extrapulmonary tuberculosis? Lymph node is the most common site for extrapulmonary tuberculosis. So, tuberculosis will be continued in part 2.